Hi and welcome to our telehealth video information series. I'm Garvin and this video is on Ibugel. So Ibugel is for the topical treatment of backache, rheumatic and muscular pain, sprains, strains and neuralgia. Ibugel is also indicated for the symptomatic relief of pain due to non-serious arthritic conditions. So Ibugel is applied to the skin to relieve pain and inflammation in a targeted area. For example, associated with muscle or rheumatic pain, backache, sprains, sports injuries, and pain from non-serious arthritic conditions, severe throbbing or stabbing pain along a nerve and in the area supplied to the nerve, which is neuralgia. So how does Ibugel work? Ibugel contains the active ingredient Ibuprofen, which is a type of a medicine called a non-steroidal anti-inflammatory drug. Ibuprofen works by blocking the action of an enzyme in the body called cyclooxygenase. In certain arthritic and rheumatic conditions, or if you have an injury, the COX chemical makes substances called prostaglandins. And these cause pain, swelling and inflammation. So when you apply ibuprofen to the skin, it stops the production of prostaglandins in the underlying tissue. This reduces inflammation and pain in the local area. Ibuprofen is absorbed into the bloodstream less when you apply it to the skin than when you take it by mouth, which means gels and sprays are less likely to cause side effects than products you take by mouth. However, absorption can still occur, particularly if you use large amounts on large areas of skin. So how to use Ibugel? Ibugel can be used up to 3 times a day or as directed by a doctor. Leave at least 4 hours between applications. Follow the instructions in the leaflet regarding how much to use. Apply the gel to the skin over a painful area and massage it gently. Wash your hands thoroughly after applying Ibugel unless you are treating the hands. Get medical advice from your doctor if your symptoms persist or get worse despite treatment. Don't use Ibugel for longer than a few weeks unless otherwise advised by a doctor. So what you need to know before using Ibugel: don't apply Ibugel to broken, damaged, infected or diseased areas of skin. Take care to avoid getting the gel in the eyes, mouth or nose. Rinse with cold water if you accidentally get it in these areas. Don't cover the area being treated with airtight or waterproof dressings, as these will increase the absorption of ibuprofen into the body and may increase the risk of side effects. It's best to protect the areas of skin you have treated from bright sunlight, because Ibugel might make your skin more sensitive to sunlight. If you experience any side effect from this medicine, in particular a rash, stop using it and seek medical advice. Can you use Ibugel while pregnant or breastfeeding? Ibugel should not be used during pregnancy unless considered essential by your doctor, as sufficient may be absorbed through the skin to affect the baby. When using the 3rd trimester, ibuprofen may delay labour, increase the length of labour and cause complications in the newborn baby. So get medical advice from your doctor before using this medicine if you're pregnant. Ibuprofen taken by mouth passes into breast milk in such small quantities that it is unlikely to harm the baby. This means applying ibuprofen to the skin is also unlikely to be harmful. However, as with all medicines, get advice from your doctor before using this medicine if you're breastfeeding. So the possible side effects of Ibugel. Using Ibugel on your skin may occasionally cause a skin rash, itching, or irritation at the site of application. If you find Ibugel irritates your skin, stop using it. Talk to your pharmacist for advice. The following side effects are also possible with ibuprofen, but extremely unlikely when using it on the skin. Digestive problems such as abdominal pain or indigestion, particularly in people with a history of stomach ulcers. Kidney problems. Allergic reactions such as asthma attacks, narrowing of the airways or a bronchospasm. Swallowing or swelling of the lips, throat and tongue, itchy, blistering rash or anaphylactic shock. Stop using Ibugel if you get it, and get immediate medical advice if you have an allergic reaction to Ibugel. So read the leaflet in the packet, or talk to your doctor or pharmacist if you want more information about the possible side effects of Ibugel that I haven't mentioned already. So can you use Ibugel with other medicines? If you're using or taking aspirin or other related painkillers such as the NSAIDs or non-steroidal anti-inflammatory drugs by mouth, for example, Ibuprofen, diclofenac or naproxen, there may be an increased risk of getting side effects if you use Ibugel as well. Check with your pharmacist before using this medicine if you're already taking an anti-inflammatory painkiller. When used on unbroken skin, Ibugel is likely to be absorbed in sufficient amounts to affect other medicines that you're taking by mouth. So do not put it on broken skin. That brings this telehealth video to an end. If you have any questions, you can leave them in the comments below or contact me through the website mytelehealth.info or call into us at Lynch's Pharmacy in Douglas and Cork or call 021 4366923 to find out more. Thank you for watching. Stay healthy and stay informed.